Welcome to the Moulding Private Practice Show, where we help healthcare practitioners in private practice keep true to their purpose and build a life of mastery by providing the knowledge, skills, and tools to bring their dreams to life. In this episode of the show, we speak to Kerry Coole about being a speech therapist and everything private practice management related. Kerry Coole, welcome to the show. So really glad to have you on board and doing this. Speaking about how you became a speech therapist and all of that good stuff. Welcome on board.
Yeah, thank you so much. Thanks for having me. Excited to be here.
Always a pleasure. And I know in the other episode I forgot to ask Shaz this, but Shaz, how did you meet Kerry?
Actually, Kerry signed up for a trial account on our practice management software, and just through that kind of got chatting to members of the team and was put into contact with me when the subject of doing the Moulding Health and Moulding Private Practice interviews came up, and we kind of set it up and really had a good idea for the Moulding Health episode and just carried through to the Moulding Private Practice. So yeah, thank you, Kerry.
Thank you.
I mean, that's always a cool story and question, to always ask, in the show. But my favorite one is to ask, the practitioners that we've had on the show, this one, which is, when you're little, people always ask you the crazy question of, what do you want to be when you grow up? So what did a young Kerry say she wanted to be? Was it a speech therapist?
No, I think a young Kerry wanted to be a travel agent, wanted to be a vet, wanted to be a game ranger, not a speech therapist. I'd never come across a speech therapist. My dad then at one stage said, oh, he went to one for a lisp, and otherwise I hadn't heard of it before, but sort of going along, I went and did an aptitude test, and I think, I don't know, grade 11 or something, because I really didn't know what I wanted to do. And I thought about medicine and I thought about teaching. And then speech therapy came out of this, and I did some reading on it. And it seemed like the perfect marriage between medicine and teaching, really. And yeah, I quite liked what I read about it, and went and had to visit a few speech therapists before I did, because I did an interview at Wits. They select like 30 people for the course or something, and so they encourage you to go spend time with speech therapists, and I liked what I saw, and I kind of felt like once I fell into that and I was offered the degree or a position in the degree, I just thought it must be meant to be.
Okay, so now I know with a lot of healthcare practitioners, once you've kind of gone through the degree, when you get the degree, before you can start practicing on your own, you need to do a community service or an internship. Is that the same with speech therapists?
Yep. Yeah, it's exactly the same here in South Africa. Our ComServe year. So we are the same as like the physios and the OTs, dietitians, where you do 1 year of community service and you get sent off to a hospital or clinic in South Africa. I think you get like 5 options. And then if you don't get one of those 5 options, you get second rounded and so on. So I did mine at Port Shepstone Hospital in Natal.
Nice. Yeah, so we've had a mixed bag of responses, but I would love to get your response. Did you enjoy community service?
Yes, I did. I loved it. It was one of the best years, I think, of my life. I think there's that part of finally you've got your degree and you can earn a salary at your first sort of like proper salary you can earn, and you're getting to actually understand your degree, because it's all good and well doing, these 4 years of practicals here and there, but once you're actually there and patients rely on you, you sort of realize what you're doing with your life. And I've spent quite a lot of time in Natal, and so I'm familiar with Port Shepstone, and so I got to stay at my parents' holiday house for that year and work there, and I'd go for a swim in the morning, and we looked after 12 clinics in the area, some of which were 2 hours away. And so the OT, the physio, the audiologist, myself would get into this 4x4, one of the government vehicles, and drive through the sugarcane fields for like 2 hours to go see patients. And it was incredible. It was fun. It was eye-opening. I loved it.
I think so. What that kind of story collaborates some of the feedback we've had. And even with my wife, I mean, what I found, because I remember towards the end of her community service, she's a clin psych, and, we got together for like this lunch. And I still remember the event or the lunch, because everyone was so bubbly, and it was like, this camaraderie, because there was the OT there, the physio, the speech therapist, and you kind of all in this one place in the middle of nowhere, like you said. Now you're going through the sugarcane plantations, and you're getting to earn some money, because if you came out of varsity, you didn't have too much of that. Most people. So yeah, it was definitely, it kind of like reminded me of that, because that seemed to be the story. I'm glad you said that, though.
Yeah, it was great.
Yeah, and I think also, I mean, what I like about speech therapists as well is that it's quite a complicated topic. We just think speech, like I said, I think we said it in another episode, but it's actually quite complicated. It's like quite technical. Do you enjoy that aspect of it?
Yeah, absolutely. I think I love that there's so many realms to it. It's funny, I was at breakfast with some of my friends this morning. I studied with all of them, and one lives in Australia now, one lives in Israel now, one's here, and I've been in London for a while, and we're all in very different areas of speech therapy, and it was just fascinating to be like, I cannot believe you went into that, and I can't believe you went into that. And myself, being more of the adult sort of acute side, looks at my best friend who does pediatrics with disabilities, and I just couldn't imagine dealing with that sort of population, yet we're very similar people. But so I just love that there's so many parts to it. And yeah, I mean, I worked at a school as well for 2 years and did my school age language, and it also then gave me an opportunity when I went overseas to do pediatrics and adults, schools and hospitals. And so I do love that. And I think I've had a few nurses say, oh, my child doesn't know what to study. What do you think of speech therapy? And I give exactly that answer. There's so many different areas you can go into within it. So yeah, I've loved that about it.
I really love that you mentioned that there are so many different areas to go into, because I think for so many people trying to think of a career to go into, you're not always aware of the fact that just because it's speech therapy or just because it's occupational therapy doesn't mean you're limited to pediatrics. So it's nice to know that there are divisions within the field. But you mentioned you were in the UK for some time. What was the working experience like in the UK?
Yeah, it was very different to here. I think I worked, as I said, in hospitals, and I worked with kids at schools, but there are even more areas here than you would think, there than here. So you can be working with adults, but you could be in a hospital, or you could be in ICU, or you could be on the stroke ward, or you can be in community. And so in the UK, I found I was lucky that I'd had the South African experience of go to Baragwanath, go to that patient and diagnose them. You're like, but I'm not a doctor. Okay, but when you go to your ComServe year and you're the only health professional that patient sees in a month, you might need to help diagnose the patient or send them in the right direction. So with that sort of experience, we are wanted in places like the UK, because we're sort of like a jack of all trades, and we can work in so many different sort of environments and areas. But then you also figure out, right, jack of all trades, but you need to start specializing. And so you get then, you come across therapists there that are a stroke therapist, or a voice therapist, or a ICU therapist, or whatever it is. And then from there, that's then where I got to what I'm doing now and what I love now, which is ICU and trachees, because I really enjoyed the acute side of things. And from that, I had supervisors that were keen on training me on something else. And then you go to courses, and then you find your path there. So I think I was equipped with the South African experience to get into where I wanted to. And then from there, I was lucky to then niche.
That's really amazing to hear. So you've completed your degree, you've completed your ComServe, you looked at going over to the UK. Was there any additional exams or boards or anything that you had to write once you arrived in the UK to be able to start working in the hospital or the clinical settings there? Or was it a case of, you're a South African speech therapist, we know you've done community service, come on in?
So a little bit of both. We didn't have to do, I didn't have to do an exam or anything, but you do have to register with the HCPC there, so their Health Profession Council. And so you have to do a breakdown of the courses that you studied in South Africa. And so if you've got your course outlines, I mean, it was a big deal at the time, and quite time consuming, but you have your course breakdown, and yeah, you fortunately we're lectured in, if you're lectured in English being the the first language there, then you don't have to write any extra exams, but it's basically just registering with the Health Profession Council there, and you have to just show what courses you've done, but it's certainly nothing compared to some of the other countries where you do have to write exams and write reports and video yourself doing therapy. It was certainly not at that level. And then actually with that now that I'm registered there, there's like a merger agreement to other countries. So somewhere like Australia or New Zealand, and I think Canada, if I wanted to go to one of those, it would be difficult for me with my South African degree because I'd have to do those tests. But because I've worked under the British or the Royal College of Speech Therapists, I can get a merger to other places. So it's quite interesting how you can take that sort of path.
That's so interesting. So I think my wife did it, but more from a psychologist's point of view. And she did say, yeah, you have to get the course outline, for each one of the courses you have to do. But you also needed like someone to collaborate the story. So you needed the reference letters or something like that. Did you need the same as well?
Yeah, I think I did. You need a I forget what you even call it, but it's basically that. It's someone to sign off that you say who you are, you say you like, and they have to do like a live signature. So because I remember I got someone to fax it to me, and they're like, and then you post it to the UK, and then they say, no, this needs to be live signature, send it back, post it again. But you do need like a reference. Yeah.
Okay, cool. And then the other thing, as you were saying about the UK system, we had someone from New Zealand, and he was a psychologist. And what Philip said was exactly what you said. You almost like get to specialize. So he worked with, lots of people from the prisons. And he says, once you plug in, I can't remember what they call it in New Zealand, but essentially it's something like the NHS. And then you register with the NHS. And then you get, clients like that in your private practice. Did you find something like that? Because, the one thing, when I think of UK, I always think it's not like South Africa from the private practice part. I always in my mind, I always have it that everyone is part of the NHS. But does it work like that on the ground?
So it does. I think, so my experience there, I did work mostly in the NHS, and then there were some private hospitals that I also worked at. Even one over in Gibraltar. I got sent on a thing in Gibraltar for a little while, but there was there was one patient that I saw privately, but it was for the reason of I'd seen them at the hospital. They needed continuing care, and my lead, the clinical lead at the time, said, happy for you to continue seeing this patient, because they specifically said, will you please help me with this when I'm at home? So generally it'll be that, then you need to say, well, here are numbers of a private speech therapist or a community speech therapist. But I was able to go and see them at home, and it was because I had treated them in the hospital. But I just know from other therapists there that are in private practice, you go onto like a sort of websites, and then they can type in adult speech therapist or pediatric or stroke or whatever it is, exactly that in that niche, and it'll come up with names, and they can call that therapist to go and see them.
That is so cool. I mean, if you can remember that, that'll be amazing. But we actually started with the UK, but we've been trying to determine how big the market is, and whether there's lots of practitioners in private practice and things like that. But that's actually so interesting. But simple things like Are the invoices different? Do you send the invoices to medical aid or do you send it directly to the client? I know like Bupa is massive, like so because we've got clients in South Africa that are foreign, but then we send it to Bupa as an example. So is that an integration that we would have to consider? So amazing stuff.
Yeah, and with that, I wouldn't even with the one patient that I did see, that patient just paid me. And then the private hospital, which was a Bupa hospital, we were paid by the hospital to be there, and not on a patient by patient rate. So I'm not quite sure how they work it out, but we would just pay it on an hourly rate. And then the hospital would obviously claim how they claim. It's a bit confusing now that I think back how they managed it.
Okay, cool. Yeah, all fun and games.
Yeah.
Any reason for the UK? I mean, so obviously you came back to South Africa, so that's an interesting story. But was there a reason for the UK?
Yeah, I mean, the UK, I'm fortunate to have a British passport because my mum was born there. So it was somewhere where I could get in quite easily, that I spoke the language, obviously. I think that's something we also think about as speech therapists is, if we're going to be involved in any sort of assisting in someone's healthcare or their communication, you need to be able to speak the language. So with it being an English-speaking, country, with me having access there, and to be honest, I also wanted to travel. So, you're in London, which is the hub of the world. And so I was able to do all of that there.
I think people forget that. I mean, how close like the European countries are, and to get on a train to France or to Spain, or it's possible, which is always amazing. What fascinates me? Sorry, you were saying?
No, I was just saying absolutely, and as I said earlier, is that I did get a post in Gibraltar, and it was just like quick flight straight over to Gibraltar. And there are a lot of British expats there, but there are also a lot of, Spanish people from there. And the border is like a walking distance. I could walk over to Spain, but that's where I learned that I think I got my Spanish to like the level of a 5-year-old with a learning disability, because those are the kids I was dealing with. So I could get like verb object, and that's as good as my Spanish got. And then I knew I actually couldn't help them anymore.
That's amazing. What I was going to say with the European countries is how different they are. I mean, it still baffles me. You spoke about Natal, but some of those European countries are about the size of Natal, and yet it's so different. I mean, like you're stepping into like another world, whole new language, whole new culture, whole new people. Interesting though.
Absolutely.
Yeah, so love that. Was there a reason to come back to South Africa? Like, was the weather just had enough?
The weather. So I think, I'd never really gone to the UK wanting to immigrate. That wasn't really my goal. It was, as I said, to go there to experience it a little while. So I always had planned to come back. And my family's here, my parents here, and my sister had a baby, and I just wanted to be involved in things, and just see if I could make things work here for me. With all the experience I got from the UK, I just thought, let me come back and let me use it here. I knew what I was capable of, and I knew what South Africa could benefit from. And my plan was to really be able to open a private practice here. And that was my biggest goal, with coming back, opening a private practice and doing what I learned there here, and having my family around. So that was sort of the biggest reason.
I love that you mentioned it that way, that, it was being able to take the experience of what you'd learned in the UK, that almost being able to really niche down into a specific side of speech therapy. Have you found in South Africa that there is a big need for those almost more niched aspects to speech therapy, or is it still very generalized here?
It is very generalized here, and so there is a need for it, definitely. With being here for the past year, I've worked with a few different practices, and I've had so many therapists sort of say to me, like, "Jeepers, where did you learn this? How, we we didn't get to learn sort of this level of what you're doing, and this is what we need. And so it's specialized, but in a broad term. So, you can go and work in an ICU, but you're not necessarily specializing in trachees, or you're not necessarily working with stroke patients or whatever it is. So I think we're still very generalized here. And it might just very well be because we don't always have the means to stretch ourselves, whether it's budget or access as well. Because if we go and say, well, great, I can go and learn this, but you have to go to a clinic that far away, you might not be able to get equipment there or the right task force with you. So if you need an ENT to pass a scope, well, no, the ENT can't come the same day as you to the clinic down in the sugarcane field. So I think it does make it a bit more difficult to specialize in the rehab sort of field.
Yeah, I think that's the one thing that people don't forget as well, is I think there's enough. One of our core values from a company point of view is like abundance, because I always tell the team, it's like, I don't think you have to take from other people, sometimes to carve out your own niche. I think there's always enough, that there is, and I think also the second point that's very close to that is, it's almost like where you point the boat is what seems to happen. You attract certain things. And I find that, even when we were speaking about the trachea earlier in the other episode, if someone has, something as niched as that, it's a big enough market that you can find that fulfillment and have enough clients around that and make a really good living and, make the world a better place. I'm a firm believer in that. And I think your story and, all of the other stories that we've heard across all of the practitioners, there's these obscure sometimes, areas of interest, but, they build their whole practice around that, or, their core focus, which is amazing. I love that. I love that aspect. But on a close point with that, do you find, did you find mentors along the way? I mean, were there certain people that helped you through ComServe, or, even I think as you were starting to think, maybe at some point I want to go into private practice, did you find those type of people appear?
Yeah, I think so. I think back at university, there was a supervisor that I just thought was like the guru of adult neuro, and it was just fascinating to hear the kind of patients she dealt with. And when we did clinics with her, those sort of patients, that drew me into the adult side of things. And I remember her saying, you're very good in this area. And when you get that sort of like affirmation, like, okay, well, maybe this is the area I want to be in. And then I suppose at ComServe it's a little bit different. You're not really, not everyone has that level of supervision there, and you kind of have to be everywhere you need to be. But I continue to be quite fascinated in the neuro side of things, because when we were going out to the clinics, you came across these patients that don't necessarily have a diagnosis, and you've got to think back like, oh, neuro lectures, what's going on with this patient? And so the patients also steer you towards that, what kind of patients you end up seeing at places. And then I think, further on was when I was in the UK, as I said, I just really became very specialist there. And it was just because of supervisors that picked up what areas I enjoyed. And they would say, look, it looks like you're quite liking ICU. Do you want a bit of training there? Do you want to go on this course? And so you get those opportunities and the push from supervisors so I think it certainly has molded me into what direction I've gone in.
That's cool. Also, when we talk about, specialization and private practice and that stuff, because we've had like an OT that came on and she spoke about sensory integration or play therapy or stuff like that. I'm always thinking at the back of our mind is, if someone wanted to start up a private practice like that, so like if someone wanted to specialize in trachea, how would they do that? Because I think what I heard from you just now was that you obviously need that specialized training, and you were fortunate enough to have that in the UK. Would you say, is there anything that springs to mind around that? So I mean, if you were almost mentoring someone and they said, I really love what you're doing, I want to do that in 5 years or 10 years, How would I do that? How would I set up a practice like that? Is there anything
Right.
that
So I
springs to mind?
think, yeah, I think there's obviously that specialist training you need to do. So it comes with not just doing courses, but the experience as well. So you need access to that level of patients, but also the supervision to make it safe for the patients and for you. And I think, as you said, I was fortunate enough to get that in the UK. But yeah, as far as I've been told, there's not really many courses on trachea management. And that's something I need to think about, maybe filling a gap with. But you need to make sure that you're getting the theoretical knowledge and then the safe experience on top of it. And certainly with the trachea, population, you're going to do that in a hospital. So you see more of your trachees, and you really get into it working in a hospital and in critical care. And so that's the environment you kind of want to be in. And then you need to start talking to your allies and your other healthcare professionals. You need to get involved with ENTs and perhaps ask if you can spend some time in their clinics and watch them pass scopes and ask them to explain the anatomy of things, or, what's going on here, what's going on there. And same thing with the physios, talking to them about secretions, talking to them about like how you sort of judge, how thick or what color or whatever it is, and you talk about all the areas that touch on the trachea from other specialists' point of views to understand it as like a whole area.
I'm glad you mentioned speaking to other people within a multidisciplinary team. So a question that we often get, or people often ask, is, as a young therapist starting out in private practice, or like, how do you build up your referral network? Especially when you are working in an environment or a profession that does require having that multidisciplinary team where you can refer a patient out if they are not the correct fit for your specialty. How do you go about doing that?
So I think networking is massive, and that's our referrals. Our referrals here have to come from doctors. Some doctors, especially because of the medical aids, there's no such thing as saying, no matter, whether it's the perfect referral, a physio can't say you need to come see this patient. It can't come from that direction. It's got to come from the doctors. But you then also rely on a doctor's relationship with other allies. So there's some doctors that might say, okay, well, this physio works with me a lot, and so if they just check with me, it's fine for them to refer to you. So I think the long and short answer is really it's networking and making sure that when you talk to other professionals, whether the doctors or the other MDT members, to explain what your role is. And that's what I've found here is that especially with a specialist area that's not too well recognized in the speech therapy sort of realm, I've needed to say, well, kind of think about it. If we do swallowing and if we do communication, it makes sense for us to work with the trachea. And this is why, this is how we can help. I understand that this is your role. So perhaps if you help me do this part, we'll find something else here. So it's collaborating as you network to explain what our role is to the others. And then from there, they start thinking like, oh yeah, Kerry, there was a patient that they had quite a lot of secretions here, and I don't think they're coming from the chest. I think they're coming from up here. So that's your area, right? Cool. Can we check if the doctor's happy for you to come and see them? Great. And then that's how you work it. It's really sort of promoting what our role is to others, so that they can then refer correctly.
Not following in line with that, but you mentioned at some point, that you have not specialization, but you registered as an audiologist and a speech therapist. Is that correct? Okay.
Yeah.
I know that used to be a thing a few years ago, but I think they stopped that now, as in you either go speech therapist or audiologist. And my question is there a reason for keeping, obviously at some point there was a reason that, they wanted those combined or linked. Is there a reason that you specifically have that, like it is linked? I mean, do you find any benefits for being on the audiologist side as well?
I think yes and no. I think the reason that I would still call myself a speech therapist and audiologist is completely just being stubborn and thinking I did a dual degree, so I'm not letting go of one, because
Cool.
rightly so, they've split the degree now in lots of places, in lots of universities, because it is a very difficult degree, because it really is 2 degrees in 1 degree time. And so yep, I still make sure that on my scrubs it's written speech therapist and audiologist, and I certainly am not practicing as an audiologist, but it's because I did my time, and I know that also I do know the basics, and there are things that do link. And so, if you're going to go see a patient and they're not following your instruction, you don't then immediately think, well, they've got a breakdown in their receptive language. You think, well, oh, maybe they've got a buildup of wax. And so, as an audiologist, then I'm allowed to go grab an otoscope and have a look in their ears. From there, I then make the smart decisions to say, well, at one of the hospitals, there is an audiologist there, so I'm going to give her a call. Can she now come and do further tests? Or could I say to the ENT, can you just come and get some of this wax out? Or could I ask the nurses to put a little bit of sweet oil in their ear to soften it? So I still touch on it, in acute care, but just for those reasons, and where I know that I have a certain level of understanding, and then I would refer further.
I would do the same, actually. I would keep both. The reason I'm asking that question is because for anyone that doesn't know, I mean, you have to do double the amount of CPD points. So you have to do for each discipline, which is the first time I heard that, I remember hearing it from a speech therapist as well. And I was like, why? Because everyone struggles just to get their 30 CPD points, but now you've, doubled your load, essentially, to be able to get that.
Exactly that.
So, I think you earn the right to keep that, which is very, very cool. Off topic as well, but being in the UK, you didn't come back with an accent? I didn't hear one.
No, but I mean, when it's funny, and I actually learned this from a speech therapist in Gibraltar. She said, people with a lot of empathy sometimes end up picking up an accent from someone they're talking to, and I tend to do that. So in Gibraltar, I had this weird Spanish twang that came along. Same thing as in the UK. I did pick up a little bit of a British accent. And then my friends or family that spoke to me or came over to visit, they would be like, oh, you got a bit of a British accent. But then coming back here, or if I spend time with my South African friends, my British friends are like, you sound so South African. So I think if you had to have spoken to me when I was still there, you might have said I've got an accent.
Okay, cool. I'm glad we're not doing this in 2 months then.
Yeah.
When you come back from the UK.
Yeah.
But cool. I think we're about ready to wrap up. Just Shaz, on your side, anything that we should have asked Kerry about being a speech therapist or considering private practice that we should have asked her that we didn't?
No, I think we covered the topic quite nicely, and I think we also got some really good insights about if a therapist was looking at maybe going to practice in the UK for a bit, just what they would need to have in order to do that. And I think just being able to speak to somebody or listen to somebody who's had the experience in both is really phenomenal for younger practitioners just trying to find their own feet. So thank you very much for that, Kerry.
Oh, it's a pleasure.
And Kerry, to finalize on your side around being a speech therapist and an audiologist, anything that we should have asked you that we didn't?
No, I don't think so. No, not that I can think of. I think we've covered quite a bit in terms of the pathway to getting here and the different areas to work in and different places that I've been fortunate to work at, and the differences between the countries and things. I don't think anything in particular, but I think just what I highlighted earlier is that we are very lucky here in South Africa to get the experience that we do get, because of the country we live in, because of us having to be exposed to like working in regional hospitals or at clinics and things, and then how that can really take you places in first world countries which you won't necessarily expect to happen, but then to be able to come back and use that here as well. And I think that's what it's all about. It's about that globalization of sharing knowledge.
I love that. I really love the fact that you got that experience as well, and that you chose to come back, and and as you said, it was always the plan. So interesting.
Yeah.
And also the fluid nature, of that, that I think you always have a choice. I think you just have to sometimes find it. But I love your story. I love how you became a speech therapist and audiologist, and thanks very much for sharing it.
Amazing. Thank you so much. It was great to think back and reflect and share it. So thanks.
Thanks very much, Kerry.
Hey everyone, thanks for listening. As always, stay tuned and we'll speak to you in the next episode.